Today we're going to do the Feiss Line Test. In this test we're looking to see if the patient either has congenital pes planus or functional pes planus. We're going to start by having our patient seated with the leg extended and the ankle in a relaxed position. The first thing that we're going to do is we're going to take the patient's ankle and we're going to locate the medial malleolus right here. We can draw an X on it with a pen. The next thing we're going to do is we're going to locate the base of the first metatarsal phalangeal joint, which is right here, which we can mark with another X. And the next thing we're going to do is we're going to connect these two by drawing a line in between them with a straight edge. Just like this. And so once we've drawn a line, we're going to palpate the navicular tuberosity, which is right here, right on that line that we just drew. So since the navicular tuberosity is on that line before the patient has even stood up, we can go ahead and cross out the patient having congenital pes planus. So now we're pretty sure that she has functional pes planus, but just to be sure, we're going to have the patient stand up on the table, keeping their feet 3 to 6 inches apart. And we're going to again locate the medial malleolus, the base of the first metatarsal phalangeal joint. And again, we're going to locate that navicular tuberosity. And this is moved right here below that line that we originally drew. And since the navicular tuberosity has dropped below that line, we can determine that the patient has functional pes planus. This can possibly be an indicator of hyperpronation, which is shown in this test. We do need to be careful that we don't solely use this test to determine whether hyperpronation is in this patient or not. The test has poor validity, so we can use a number of other tests to truly determine if the patient has hyperpronation or not.